Here is a man with obsessive-compulsive disorder, which is an anxiety disorder. The obsessions are constantly occurring thoughts or desires that a person tries to appease, even though they may inhibit the person's functioning or essential life tasks. The obsessions typically lead to a lot of anxiety. The person repeatedly does compulsive behaviors to ease these obsessions. Here, the sufferer has an obsession with being dirt-free and therefore washes his hands repeatedly to try to rid of any dirt present. Another obsession is making sure that everything is perfect, and which typically leads to the person being a perfectionist. The subject is repeatedly tucking in his shirt because it does not feel right on him, and is trying to make sure that it does feel appropriate, and will do it again and again until it feels correct. After a few attempts, he will finally be happy and move on, even though he has wasted valuable time. Next, he moves on to organizing things in his household. He likes the things to be perfectly straight and evenly spaced, or else he is unhappy with the results as they are not perfect in his mind. The perfection can also involve simple tasks, such as picking up a can and closing a door in this situation. As seen here, the subject is not happy after the first time and will go back and do the task again until it is right. He will replace the can, go forward and pick it up, turn off the lights, and close the door to see if it feels more perfect this time. He's going through the same motions over and over again, which are wasting precious time, and yet he cannot deal with these compulsions even though he knows they are wrong. He does it a third time, and after this time, he finally feels safe and leaves.
Welcome, you must be my new patient.
Yes, I'm Paul. It's a pleasure to meet you. May I come in?
Absolutely.
Thank you.
Oh, welcome, Mr. Friedman. My name is Dr. Sentry, and it's wonderful to have you here as a patient today. Please take a seat.
Thank you, sir. So, I assume you know why I'm here, but my last psychologist told me that, diagnosed me as having OCD. I have a lot of problems with my obsessions. I really have a problem with clean hands. I wash my hands about 4 to 5 times every single time I need to go, and it happens every about 15 minutes that I feel a need to go wash my hands. And also things like tucking in my shirts in the morning, it's becoming very difficult to get ready because I have to make sure it's perfect. But it's been very hard for me. And I've spent a lot of time organizing my room to make sure that everything is in order. I need the room to be in order. I was hoping you could help me. My last psychologist referred me to you, saying that you would be the best in this field that he knew.
Oh, absolutely, Mr. Friedman. Well, according to your file...
Wait, hold on. Do you have any hand sanitizer?
Oh, I apologize. We do not have any hand sanitizer.
Okay. I'll be fine, but it's just... No, never mind. Just continue on.
Well, according to your file, you very clearly have a severe case of OCD.
I already know I have OCD, but what can I do about it? I mean, that's why I'm here. Is there anything that can be done?
Well, there's this great therapy called cognitive behavioral therapy, or CBT for short. It's been shown to be very effective in patients with OCD.
Right. Okay. How does it work exactly?
So the way CBT works is, well, in OCD there are certain obsessions that are related to anxiety, and these result in compulsions to behave a certain way, and these behaviors negatively impact your life. And then, yes, well, what you do in CBT is when you become aware of what causes you to be anxious, and then you become aware of when you are compulsed to do certain behaviors. You have to try to consciously not do the behaviors.
I don't know if you know this, but that's extremely hard. I mean, if my hands are dirty, if my shirt is not tucked in right, I can't help it. I'm 5 steps out the door, and I have to turn around and just check the lock again. I can't control that.
I understand how hard this is for you, Mr. Friedman, but rest assured, we can help you.
Okay.
I can also recommend some drug therapies, which have been, along with CBT, medications have been proven to be extremely effective in the alleviation of symptoms in patients with OCD.
Okay.
Now, for drug therapy in OCD patients, we typically prescribe SSRIs, which are normally used as an antidepressant.
But if they're an antidepressant, how are they going to help me?
Well, the way they work is they help to increase the level of serotonin in your body.
Okay.
And
what does that do for me?
Serotonin has been linked to OCD, and low levels have been shown to cause anxiety.
Okay.
Then by increasing the level, we reduce anxiety, which helps to stop the compulsions and behaviors.
So you're saying that with your cognitive behavioral therapy and these drugs, you can help me?
Yes, we should be able to treat you.
Okay.
So I'm just going to write you a prescription.
Okay.
And so the way this therapy will work, you can meet with me a couple times a week, and then in a few days I can check to see how the exposure therapy and the drug therapy are working for you, and then we can go on from there.
Great. Thank you, doctor.
Anytime.
Okay. Bad. This is pretty bad. Hey, Doc, it's been a while.
Hey, Mr. Friedman, it's nice to see you.
Nice to see you too. May I come in?
Absolutely.
Thanks.
So, Mr. Friedman, how's the treatment coming along?
It's going pretty well. I mean, the exposure therapy is really working. Not having any more difficulties with the dirtiness, the cleanliness. It's been pretty good with the drugs, taking them every day. The serotonin inhibitors really, really helped. I'm starting to feel a lot happier with my life, and I'm not really that anxious when I go anywhere. The stress is not killing me all the time. It's been really amazing, Doctor. Thank you so much for all you've done.
Oh, you're welcome.
Well,